Kenny. I'm the former director of the Center on Women and Public Policy at the Humphrey Institute, and I'm really glad to have you here. And I think I have a unique perspective, perhaps as the only political scientist in the room. And I feel like in my lifetime, we've had 2 chances at healthcare reform, and when we didn't do it the first time around. And if we miss this chance to do it now, I don't think we're going to get another chance. And I'm really counting on you to seize the moment and make it happen right now. And one of the reasons that I was one of your earliest supporters before you even announced, and spent a lot of energy in the feminist community saying, you're our guy, is because I believe that you would stand up to the people who we're now seeing, that you had the intelligence and the strength to stand up to the people that we're now seeing derail all of our town hall meetings. And I'm scared to death that they're going to win again. And I'm also really been affected this summer by the murder of Dr. Tiller. And I think in the murder of Dr. Tiller, you see the fruits of what Bonnie decried as allowing women's health care to be exceptional, to be outside our health care system, unlike Western Europe, where women's reproductive health needs are part of the wider healthcare system and then not as easily targeted. I guess I'd also like to, the third point I'd like to make is to say that just how to congratulate you for the wise choices that you've made in your staff, and some of us have really been watching, and in your choice of Lauren and your choice of Bethany. I think that you, and Natalie, that I think you've really ensured that women's voices are going to be heard in your office, and we're going to be continuing to watch you on that and to make sure that those people have leadership positions.
Never get any end of it.
But I think something we know from women in business is also true, as all of us are talking about organizations, whether we're in other institutions or we're a standalone nonprofit organization struggling to survive in a hostile economic climate. And even though we have the support of the Women's Foundation of Minnesota for our project at the Center on Women and Public Policy for the Status of Women and Girls, which is going to hopefully be giving us a lot of good data about healthcare, I think the Powell Center is right behind me saying that women's things are first on the chopping block, whether it's programs for domestic violence victims that we're seeing being eradicated in our court system, or other programs. And I'm, as you know, I'm leaving the Center on Women and Public Policy to go to Tulane University, and right now the University of Minnesota has no plans to replace my position, so I think you can really expect to see Women in Public Policy and the Center on Women in Public Policy disappear. And I think the same thing—
Well, that would be your fault.
I think, you know, the Powell Center on Women's Health is right behind me. I don't think, because, you know, Bonnie really tried to represent our strengths, I don't think people really, and we do so much with so little, like the Women's Foundation does all the time, but we're very fragile, and we can be disappeared again. And so that's maybe not the role as a legislator, but and now as a person with great stature in our community to say, whether it's at the university or it's in the nonprofit community or it's through foundation funding, that we're not going to lose our community.
You know, I'm just encouraged by the number of women we have in the Senate, encouraged by our HHS secretary. I feel, I know we have to be vigilant, but I just feel like we're making progress. You know, I was so happy to see Sotomayor, and I think that we're hopefully are going to continue to make progress. But I take all your points, and we'll be vigilant.
Yet that progress isn't being seen at the University of Minnesota. I mean, the 14 years I've been here, a number of the women's programs that I came here to be a part of have been shrunk and disappeared. And so there's this kind of, we're kind of in some ways the victims of some of our success, but the things that made that success possible are going to vanish if we're not really careful all the time.
Okay, well, my name is Donna, and I'm the Administrative Director for the Powell Center for Women's Health, which is housed in the medical school at the University of Minnesota. And except for a short stint with Senator Kennedy's committee, Lauren came straight from us to you. So we're very proud of her. I'll back up a little bit and talk a little bit more conceptually, because I'll just repeat what others have said otherwise. I think everything that we do at the Policy Center, we approach from the standpoint of evidence-based research. Our mission is to catalyze research partnerships that impact women and their families and communities. And so we look at this in a more holistic way. And we do that through academic and community partnerships. So we actually do research in the community with different community groups. They identify healthcare need that they may have, and we help them do the research and evaluate the project and craft an intervention. And Lauren is very familiar with that because she really started much of that at the Policy Center. But the belief underlying all of this is that women's health is essential for the health of the community and for the health of the nation. And this isn't just us saying this, the research supports this. Just as the research shows that when women are educated, their families do better economically. They also do better health-wise when women are educated. And the other thing is that women do have distinct health needs. But women's health care is basic health care. So pap smears and gynecological exams and breast screenings are basic health care. Contraception is basic health care and should not be excluded from coverage. Women spend about 5 years of their life trying to get pregnant or being pregnant, and then they spend another 35 years trying not to be pregnant. So, when you look at that, you can't say that contraception isn't basic health care. It's almost
considered preventive care.
It is definitely preventive care.
Let me tell you
has
why.
an impact on women's education, economic stability, all of that. So that has to be, reproductive health care has to be treated as basic health care. But that being said, women are also more than some of our reproductive parts. It turns out we have hearts and brains, kidneys, and all those organs just like men do. And so,
shocked him.
And so there has to be official recognition, there has to be policies in place that recognize the sex and gender differences in health and in women. That there are diseases that affect only women, there are diseases that affect men and women, but women may manifest the disease differently, and they have different symptoms, they may respond to treatment differently. And so that's when the Policy Center gets very interested, because that's what we look at. We look at sex and gender differences in healthcare and at the specific other health issues that may affect women. So we need to do research and make sure that the sex and gender differences are looked at, and then we need to follow through and, as an academic institution, make sure that providers understand those differences and learn how to identify and treat them.
Well, just one thing is this bill, the health bill, says that there will be removes any gender bias, any kind of coverage, and those sound like basic coverage and preventive care.
I would just say one more thing, like in the area of cardiovascular health, men are actually more at risk for heart disease at an earlier age than women, but more women die after a heart event, after a heart attack than men. So the mortality rate for women is higher than it is for men. Is that because they don't go as fast? So they don't identify? It's because we present symptoms differently. There is gender bias in some providers. Some providers don't understand that women present differently for cardiovascular disease. So we pay for that in a higher mortality rate.